Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Hearing is everything. We know that as one ages, it's very difficult if you don't hear well, but many of you don't even realize you don't hear well. So the way you can know, you keep asking the same question. People look at you like you don't know what you're saying. So I thought it'd be a great thing to bring on a real expert. And MICHANNE Davidson, Dr. Davidson, is an audiologist, and she really understands this whole market. So I thought that her company, Active Life Hearing, would be a perfect place for us to start. So welcome to our show, MICHANNE.
Thank you. Glad to be here.
You know, MICHANNE, you've been in this, I would call it a business. It is a business, but it's really it's a medical situation. I don't like to call it a business because I know when my husband was living, the hearing aids were the most important thing. If he didn't have those hearing aids, it was not very happy for him, nor was it happy for me.
Exactly.
So tell me why you even went into this business.
Well, at a young age, I had an elderly grandmother that lived with us who was very, very hard of hearing. And I remember not being able to communicate with her well. Her options were very limited back then for assistance, and that stuck with me. And when I went to college, I said, I want to help people like that, and that's really how it happened.
And that's what you do. And I know from talking to you, you do get a great thrill after this when you test someone and they can't hear well, and then then you're able to make them come back into life.
Right. And that's what really makes me feel like I don't even work. It's really about having fun, connecting with my patients, and finding out just what their needs are and help them solve them and grow to be friends with them in the process. It's awesome.
And something that people it's a misnomer. They think it's only for older adults that they need hearing aids. And why don't you talk about that? I mean, there's a very romantic story, which of course shows that that's true, but there is a growing concern. I don't know if you think it's because the kids of yesterday have been listening to this terrible loud music and that's causing this hearing deficiency?
There's hearing loss. The number one cause of hearing loss is noise exposure. Of course, you have to add hereditary factors, the natural aging process, other health issues, but noise exposure, which is just gaining and has become such an extreme problem today. Yes, that is why we're seeing hearing loss at a much younger age.
And maybe we ought to I love the story of your husband, so why don't we just do it, because he likes to tell it, and I know sometimes it embarrasses you, but it's
he
important.
tells it way better than I do,
That's right.
And I am embarrassed because I broke the cardinal rule, don't date your patients, but it did sort of happen. He was fit by a colleague of mine. It wasn't my practice, it was hers, and the story is he needed some adjustments, and he just wasn't doing that well with them. And so he came in to tell someone at the front desk, and she said, why don't you see MICHANNE? And there she is. And his story is, as soon as he looked at me, he's like, okay, I'm ready for my adjustment. Little did I know, he kept coming in quite frequently over a year for more and more supposed adjustments that he didn't need. And apparently a year later, he said, he asked me out on a date. And so that's kind of how it happened. And I think I turned 12 shades of red, but did accept. And
tell me what
went on from
let's
there.
go back into his hearing situation. Why couldn't he get the hearing aids right?
Well, there is a particular expertise in making sure hearing aids are meeting the needs of a patient. And at the time, my colleague was more of a pediatric audiologist, not one that specialized in adults only, which has been my entire career for 30 years. So I believe that I just had that skill and have that skill to work with adults, specifically with what they need in today's very busy world. And that is, he's a professional. He has a busy life.
He does, and I've met him, and he is that way. I think what I'm going to do is I'm going to start giving the phone number, because I know by the end of this conversation, people are going to want to get to you, talk to you. So let's start by giving the phone number now. So get your pencils out. Remember, this is Pencil Talk Radio. So it's 954-994-4444. 4143. Yes, it's 954-994-4143. I'm sure a lot of people listening to us have hearing aids in their drawers. That's a big story. Why do they keep them in their drawers?
There are a variety of reasons. I would say they're probably having older technology levels that weren't meeting their needs. Hearing aids are so much faster in processing sound and reducing noises and connecting with Bluetooth and televisions and computers. So nowadays they can satisfy so many communicative issues. In the past, they were not so good. So I suspect they're older technologies. It could be that they need adjustments. I have patients that have hearing aids too that might be a year or two old, but were never properly adjusted. And I said, before you try new ones, bring in what you have. Sometimes I can just adjust those and send them on their merry way, and they do great for a couple more years. So variety of reasons.
And there are a lot of different hearing aids because I've heard discussions. Someone says, mine's better than yours. Mine does this. Mine does that.
There are literally hundreds.
Really?
Yeah. There are some, maybe 6 or 7 manufacturers, but within the manufacturer's profile, they might have 50 hearing aids each. So yeah, it's hundreds. Yeah.
And that's your expertise, isn't it? That once you test this person, you have enough knowledge to not make them try those 50, but you get a pretty good idea what they should try, don't you?
Correct. We go through a list of questions, qualifying questions, to find out where their difficulties are. And do they want something that connects with an iPhone or a computer or a television? Or do they want something simple? Do they need something that recharges, something they change the battery in? So we have to narrow down the scope. That's my job. And then we take it a step further and we have demonstration hearing aids. We actually let them borrow them like a library book. They check them out, they sign them out. There's no charge to do so. So I'll make the choice with the patient. Let's try these first. I want you to wear them for a week. Bring them back. We'll assess how you did. If I felt that, we were close but not quite, they're sent home with another set. So we really work hard to find exactly what they need.
Now that's a whole new idea because, before that didn't quite happen. Maybe it happened a little bit, but I look at the light in your eyes and that excites you that you can try it. And if it doesn't work, they do. And that way, I think they'll have more belief in hearing aids, won't they?
Exactly. It's my dream. It's something I've always wanted to do, but was never able to until now.
Now, knowing something about hearing aids, of course, my husband, wore hearing aids, and I understand he spent a lot of money on hearing aids, and then this wasn't right and that wasn't right, and he had to keep coming back. But you have invented something that I think is great, and you call it unbundled pricing. Why don't you talk a little bit about that?
Okay, I could talk a lot about that. So let's see. I'll start with history, a very short history. Typically, hearing aids were fit to a patient, and they were told, you don't have to pay for any visits for the life of these hearing aids, which at the time was 3 to 5 years. Now the newer ones are a little bit longer. But what happens with that, it inflated the price so much because all those visits had to be paid for. They were just all bundled together in one price. And the older hearing aids, which were analog, we actually adjusted them with screwdrivers. They were not that reliable. They would break down constantly. Patients would have to return for visits and problems and things like that. But with modern technology, we're talking water-resistant, waterproof hearing aids. They don't react to sweat. So the reliability of the products are much more robust now. So you combine that with the ability to fine-tune everything really very precisely with computers, that patients typically after a few visits really don't need years and years of follow-up. So in the audiology field, we're trying to figure out how can we reduce the cost of hearing aids so more people have access to them and access to better technology. Who doesn't want the best hearing they can get if they can afford it? So unbundled in the audiology industry means that in our case, the cost of the hearing aids include 3 months of visits, which during that 3 months, we're tweaking it precisely to the patient's needs and really educating them on how to care for the hearing aids themselves so they don't have to come back weekly or monthly, which is difficult for some people with driving issues or work issues. And once we do that, or once we figure that out, we now can say, well, now you don't have to pay up front for visits that you don't need. So unbundling means that they don't have to pay for a lifetime of visits any longer that they're not going to use. And they can save this way by maybe $2,000 a set on average.
See, that's very important. I want you to be emphatic on that. So what you're going to do, you may charge after 6 months, a year, 2 years, but the original price is going to be less.
Yes, the original
really
price
important.
is usually a couple $1,000s less. And after 3 months, typically patients are only coming back once a year, and that would be a $55 office visit. And
who doesn't want what you've just said? I mean, this is, I've never heard of this. Is this your own invention?
The specifics of it is, but the audiology field in general has been working towards trying to find a way to lower the cost of hearing aids because, frankly, our goal is one day that maybe it'll be covered by Medicare or health insurances. And until we can bring the cost down, that's never going to happen. This is like one of those early steps. And I'm very proud to be able to bring that to the area. I think I'm the second provider in the state of Florida to do this.
Oh, hooray. I think that's so important. I know, and I always can use my own experience that, yes, it was a lot of driving, and yes, then it gets tested. But the big thing is that they then get, the person wearing the hearing aid gets very discouraged. They said, oh, it doesn't work anyway. I'm not going back, right?
I haven't seen that in a long time, but yes, that was the past. I can say, let's see, in the last 2 years, I think I had one person that didn't adjust to their hearing aids. And that's a really good track record.
Yeah, that's wonderful. Let me give the number again. This is MICHANNE Davidson. That's Dr. Davidson, who you're listening to. The number is 954-994-4143. And you will be able to talk with MICHANNE. You can go and make an appointment. Is the first appointment complimentary?
It is. So that first appointment, we examine their hearing at no charge, counsel them on what available products are for them, how we can help them, and then if they need a product or a hearing aid or hearing aids, we find what's appropriate and send them home with a demo set. So we do all that in the first visit at no charge.
I really wanted to go over this. I remember that people, mostly women, didn't want to wear hearing aids because it made them feel old. And yet they never realized that if they have to keep repeating something or keep asking for someone to talk to them, is that not old?
Exactly. If you stay connected with the world around you, that keeps you much more younger and youthful and vibrant. Just being a part of everything, that connection, no doubt about it. But I would agree. I would disagree with you. I find that more in men than women.
Really? Because women can cover it with their hair,
They can cover it with their hair.
But men are, vain. That's right. The men don't want to do that. Now, there are different looking hearing aids, aren't there? Why don't you explain that?
Well, today, probably the most common instrument today would be called a receiver in the ear. Receiver is another word for speaker. And so we place a very small unit behind the ear, match it with hair or skin, and a wire as thin as a fishing wire runs along the front, and then a little tip disappears into the ear. It's almost invisible. And this is the most common product today because you don't even feel that it's on. In fact, most people forget within the first week that they're wearing them. And it hides beautifully. So that's probably the most popular.
I'm thinking now of a woman. I'm going to have to definitely get her to you because she's very active. I guess she's in her 80s, and she can't even use the phone anymore. She can't hear well. And when I said, why don't you go to get a good hearing aid? I've tried them all. Nothing works.
Oh.
So I'm going to have her go to you. I really am, because I have a lot of confidence in you. And what's happened is she always has to say, here, you take the phone, to her husband.
Right.
I mean,
we've solved that problem. And would you like to hear how?
Yes.
Well, first of all, with cell phones now, we can stream the call directly into the hearing aids wirelessly. So if you're on your cell phone and you make a call, you actually hear it playing in the hearing aids. You're talking into the phone or a wireless clip that you wear. but the call is perfectly audible using both ears. It's like turning your hearing aids into a wireless headset. It's amazing technology.
I can't wait to tell her, and I can't wait to tell her husband because, he feels so sad that, I can't literally have a conversation. I know that I've tried to get her to get clear captions, which is something else, but that's not good enough. When she's out, she wants to be able to talk.
Correct.
So, it's funny. I'm a little embarrassed to tell you, but I don't even see her as much because she feels so badly that maybe she's reading my lips now, but we don't have that conversation anymore.
Exactly. And we see that people with untreated hearing loss will often pull away from personal relationships because it's just too difficult for them. They're embarrassed. They don't want people to see that they're suffering. And so they just withdraw and pull away. And that's one of the saddest things. And it's totally not necessary anymore. So please have her call me. I want to help.
Yeah, I'm definitely going to do that. No, there's no doubt in my mind. But let me just ask you to sum this up in a way. The phone rings and they call Active Life Hearing. What do they ask most of the time?
What do they ask? They ask, what's the charge for a hearing test? That's probably the number one thing. And,
Right.
I tell them there's no charge. And we don't push. We're here to help. Come in, talk to us, let us check it out. And sometimes we send people away and say, you're not ready. Come back in a year, let's retest. But if we find hearing loss, we really try to very gently encourage them and their family members to try something.
And it's a very good point. They really should bring someone with them who understands, who's there, the one that's affected, right? They shouldn't come by themselves.
They shouldn't come by themselves. And sometimes that can be a motivating factor for a patient when they really find from their significant other that person is suffering along with them. And that person wants to talk to them more and be more a part of their life, but it's so difficult for them to constantly repeat that it's causing interpersonal issues. So we love that because once they actually hear from that other person and I'm able to bring that out, it's a motivating factor for them to finally try something.
I'm sure when they're there, she says, I don't really need hearing aids. My wife or my husband made me come. And then the other person will say, yes, you do, because you can't. There's like this confrontation going on.
Exactly. And also, I really involve the significant other because when we're setting hearing aids, who do they want to hear the most? It's the person that's most prominent in their life. So we have their significant other take different positions around the room and down the hall and try to simulate what happens in the home, then amplify that and revisit those same situations. And then they say, oh my gosh, I can hear them in the other room. How is that? I haven't been able to do that in years. And I said, that's the hearing loss. You didn't even know it. And so we corrected, and it's just like a light bulb going off. It's awesome.
That really is a great story. And I'm so glad that you're doing this because you do seem to have a heart on this. You're not, and I have to say this, that a lot of times they're hearing specialists, nice people, but maybe they sold vacuum cleaners before they did something else. And now they're a hearing specialist. But what did it take to become an audiologist?
Well, it's, let's see, how many years of school? That would be 7 years of college. Yes, it's a doctoral degree. So it was 5 years for my master's degree, 2 additional years for my doctorate, and add 30 years of working with patients nonstop with raising a family and all that. And that's me wrapped up in a bow.
Right.
For them.
Yeah, and you can hear all this in her voice, and she's everything that she sounds like. So we want you to go now. I know you have different offices. Mm-hmm. So how do you work that? So if someone calls, of course, we've given them the number, the 954-994-4143. But then you ask where they're located, and then you try to make arrangements to the closest center that you have?
Yes, I have one in Coral Springs, which is fairly central. It's close to the Sawgrass Expressway. I have patients that drive from Miami and Naples, and then just close by, Margate, Coconut Creek, and so forth. And then I have a East Boca Raton office, which is right off of Palmetto Parkway near the City Hall of Boca. Also very easy to get to. So my Eastern people tend to drive to that office, and office number 3 is on the way in West Boynton Beach. So a few more weeks for that one. Go ahead.
Well, I think it's very important, and I've heard this before. It's one thing to go to a restaurant nearby, But when you find a good audiologist, you need to travel if you have to travel, because once you get fitted, it's not like you're going to go and have a dinner every night. You know, you may not see that person for 3 months, 6 months, but this is your life. This is I think some people spend more time buying their car.
Isn't that the case? And I try to explain to them, hearing aids are medical devices, and they need to be adjusted, and you need to be trained on how to work with a medical device. It's not like you said, a vacuum cleaner or a pair of shoes that you open up a manual. It's much more complicated than that. And the computer software is very complicated, and you have to make sure you have someone that can understand that, and all the new assistive devices available, and Bluetooth, and it's important to have the right person.
I think your phone, what you described in the phone, is marvelous, that it all comes right through their phone. So there are different ages that come to see you. So of course there are young people who don't hear, only be really young, but it's a hearing disease, isn't it? That's something.
Well, absolutely. If it's, I work with 18 and older. So typically someone, if they're in the 18, 20, 25-year-old range, it's something from birth or something that was acquired over time. I'm working with a 32-year-old disabled young lady right now who was born with hearing loss, and she is also special needs, so she comes in with her family, but she works, she has a job, and so she has to hear better, and so we're working with her. And then you'll have people that, let's say I have someone the other day, they owned a printing company, so it was years and years of working around a printing press. Retired dentists are also very common patients because of dental drills, so their noise history has contributed to hearing loss as they age. And of course, then you find other health issues that are related to hearing loss, like diabetes and heart disease, kidney disease.
I don't know very much about that. How does that work?
Well, heart disease, obviously there's a condition where the blood flow is not great, and the blood flow to the ear can be compromised, and hearing loss deteriorates. Same with the diabetes. Diabetes results in reduced blood flow. That's how people develop neuropathy and other things, because blood flow is compromised. It affects blood flow to the inner ear, and then hearing loss occurs with that.
Well, the one thing I've heard too is, if you don't take care of, you have hearing loss and you don't take care of it, does it get worse?
The hearing loss itself, in other words, the structures of the ear don't get worse, but what gets worse is the brain's ability to process. Everyone's heard that saying, if you don't use it, you lose it. That's referring to the brain. The brain has to be stimulated for it to function properly and efficiently. So just as any skill, if you don't do it over and over, you lose that ability to maintain that skill. It could be in anything that we do. I used to be able to do cartwheels. You should see me now. I didn't practice it for 40 years. I am not able to do a cartwheel. So it's the same with hearing. If we don't keep that brain stimulated, the auditory pathways of the brain, there's a degradation in the brain that occurs. If they let it go too long, hearing aids then become ineffective, because it can't. You can put the sound in there, but the brain can no longer process it. So it is important to keep that brain stimulated. And with everything going on with brain health today, that should be people's main concern.
Let me just tell you again that MICHANNE Davidson is the audiologist we're talking to. She has her practice is Active Life Hearing, and she's very excited about this unbundled pricing, which when you go to make an appointment, you can talk to her. The hearing test doesn't take very long. I don't think, about 30 minutes maybe?
At the most. The actual test is maybe 15, 20 minutes, and the rest of the time is counseling, learning about their needs and addressing their needs. So.
And what is the hearing test actually showed? Is it going to show in both ears? Mm-hmm. If they have one loss, maybe they don't have loss in another ear? I don't know how that happens.
I do a standard full hearing test, which is checking their sound levels. What's their threshold of hearing? What's the softest sound they're able to detect? We follow that up with word testing to see how the brain has been affected by the hearing loss. And then we also check the physical function of the ear through bone conduction testing to make sure there's no ear disease that has to be addressed. So we check it all. If we find ear disease that needs medical treatment, I have a wonderful list of trusted specialists, ear, nose, and throat surgeons, neuro-otologists that I would refer out to if we feel that that patient actually needs medical help prior to trying anything with hearing aids. So we always determine that first.
All right, now this is kind of a weird question. What if someone's had hearing aids, they don't work, and they come to you? What happens then?
Well, we assess the ability to get them working. Obviously, I'm there to advocate for the patient. And I have oftentimes patients will come in with hearing aids that have been not used for months or a couple of years. And I'll say, you know what? You bought really good hearing aids 2 years ago, but you have a broken wire and you just threw it in the drawer. I can fix that wire for under $100 and we can get those working. And let's try these before you go on to the next step.
I love this. You are so good. I mean, I am so happy that you actually came on our show. I know we're going to be reading an article in Boomer Times that you're going to write, and so we're going to hear and see a lot of you. And I'm so happy, MICHANNE. You're really great. It's one of the most important things that someone can do, more important than some of the doctors you go to. Go to a hearing doctor and get yourself put together. So I'm going to give the number one more time. Remember to write this down, make an appointment. 954-994-4143. MICHANNE is as beautiful as she is smart and charismatic. So it's a rare thing to find someone like you. I'm glad you're with us.
Thank you so much for helping me get the word out. Hopefully we can help more people.